It's a birth defect that affects 1 in 800 babies each year across the globe. But the good news is cleft lip and cleft palate can be treated successfully with surgery.
July is National Cleft and Craniofacial Awareness Month. This morning we welcome Dr. Rick Kapitan and Abby Arthur from Carolina Center for Oral and Facial Surgery, along with Mike Gilmore and his daughter Felicity. Welcome all of you to Charlotte today. Thanks for being here.
Thank you.
Felicity, hi, I see you. Oh, right on cue, right? Let's start with you, doctor. First off, what is cleft lip and palate?
Well, cleft lip and palate, Colleen's a condition where in the development of the human face and jaws, the fusion process that normally occurs to form the face and nose and the mouth as well doesn't happen properly. And you can see the illustration there on camera where a variation in the degree of separation can occur, and then the child goes on to develop and be born with that separation.
What actually causes the cleft palate?
Well, from what we know now, the process by which that fusion occurs does so because of a chemical pathway that has to occur. If there's any disruption in that pathway, whether it's from a genetic disorder that can be inherited, random genetic mutation, or even an external factor such as medication or environmental pollutant, then that fusion process doesn't occur properly.
Okay, so what problems can arise for a child, health problems or concerns, who has cleft lip and palate?
Well, it varies based on the severity of the clefting, but it can range from speech and development, certainly feeding from early on, from infancy, speech development throughout childhood, and then of course because of the facial component, the socialization and social acceptance of the child can be affected.
Now, this is where you come into play. How can this be treated?
Well, the good news is that this condition is identified very early these days. Typically, it's on fetal ultrasound, and so we're able to identify the condition that early. Parents and the child are referred at that point to discuss the future treatment that'll be necessary. They're referred to our cleft lip and palate team, where they are evaluated by a team of specialists, and then we can plan out in advance and help the family understand and prepare for both the surgical and non-surgical therapies that child will need.
And it's life-changing stuff, and you really do function as a team. I've had the chance to visit your beautiful, friendly office. Abby, you're the patient care coordinator. Why is it so important that you really function as a team?
So with Cleft Care, team care is the gold standard. We have a multidisciplinary team of providers that our children will need to see as they transition through growth and development. And our ACPA approval means that we are in compliance with strict standards that mandate our treating our children with the best, most complete care.
And Mike, your daughter's born with a cleft palate. So how was the care that you received and just the entire experience?
Well, the biggest thing, is the uncertainty before she's born and kind of not knowing what to expect. And that's why it's so important to have a team. And Dr. Kapitan and Abby's have done such a great job for us, explaining things, answering questions throughout the whole process, and really recommend that team care provided.
I know, Mike, that must have been a difficult time for you and your wife when Felicity was born, and you knew this. We see a picture of her there. She's how old now? She's a year old?
Yeah, she just turned a year.
And Felicity, let's see your beautiful smile. If we can take that sippy cup away from you. Hi, sweet girl. Hi. Oh, look at that. Oh, she's beautiful. She's beautiful. But really, it must have been a difficult time. And I know that the treatment that you received, and they really walked you through the whole process probably, and really were able to calm your fears?
That's the biggest thing is not knowing what to expect, and that fear of that. But when you do have a surgeon like Dr. Kapitan that you're comfortable with, that's the most important thing.
Dr. Kapitan, you're on the board of directors for the Free to Smile Foundation. Can you tell us what that is? Yes,
the Free to Smile Foundation is a nonprofit medical organization that's made up of many different types of volunteers from across North America. It was founded by Dr. Byron Henry and his wife Stacy in 2008, and to date have provided almost 1,000 free surgeries to children that suffer from this condition throughout Central, South America, and Africa. And one of the things we're most proud of is that the volunteers pay their own way, so that dollars that are donated go straight to the surgeries themselves. And I'd encourage anybody that's interested in learning more and possibly donating to visit the website and learn more.
It's freetosmile.org.
Freetosmile.org, absolutely.
Oh, God bless you for doing that, really. That's remarkable work. To learn more, call Carolina Center for Oral and Facial Surgery. The number is 704-716-9840. Again, 704-716-9840. You can also visit their website. It's mycenters.com, mycenters.com. Thank you so much for being here today.
Thank you. It was our pleasure.
And thank you, Felicity. Yes, that's right. Mike, thank you. You have a beautiful daughter.
Thank you very much.
Beautiful daughter.
Thank you, sir. All right, when we come back, we're heading outside.
Yes, we're making pizza on the grill. We're going to show you the sauce that makes all the difference.